Dr. Christenson, thanks for joining me.
Thank you. I'm very happy to be here.
So, can you start with a little bit of your background, the broad overview there, and then tell us about the burden of AMR and what you're focused on with it?
I'm a professor of pathology at the University of Maryland School of Medicine, and clinically I direct the core laboratories at the University of Maryland Medical Center, and I also direct medical director of the point of care services here. And so I think what we'd like to talk about today is microbiological resistance. And this is a huge problem worldwide, mainly because it's a major cause of sepsis, which turns out is the biggest killer worldwide, and kills one of every 3 patients that is hospitalized here in the U.S. It's interesting how this has evolved, where antibiotics have certainly been effective therapeutics for several generations now, but I guess we have to be aware and remember that microbiological species are always evolving. And during this evolution, if you think of ways to defeat them, then their makeup and their evolution has been throughout time that they determine ways that they can defeat these mechanisms. And so the more that we expose these species to antibiotics and other, what to them are poisons, that the better they get to defeat these chemicals. So that's, I think, what has happened over the ages as we have as antibiotics have become very popular in medicine, certainly, and been life-saving to so many, but also in areas such as agriculture and for treating animals and increasing the yield of meats and the animal health husbandry side of things. But of course, certainly their waste and has antibiotics in it. Hygiene, certainly, in many countries, including the U.S., is not ideal. And so what happens is we get exposed to these species that are resistant to our antibiotics, and therein lies the problem. And I think the way we have to think about diagnostics is what they provide to the clinicians, to folks, is information. And so the information that clinicians need in order to select the right treatment for that individual patient. So what diagnostics can do is there's certain ones that are used in just about every patient that comes into the hospital through the emergency department or any other way where they might be acutely ill. And one of these is the complete blood count. It's interesting that a generation ago, the guidelines stated that you could make the diagnosis of bacterial infection just with a CBC. Well, it's turned out that evidence since then has determined that no, that there are many causes for white cell, a white blood cell increase, for example, is something you might see on a CBC that could occur. And so it turns out the sensitivity and specificity are only maybe about 75 or 80%. So this is an important tool and is run on virtually every patient that comes in the hospital, but it's not a definitive diagnosis. For that, we have to use microbiological tools such as PCR in many cases, such as culture, and so on, depending on the question being asked clinically.